Hello, you're welcome to today's conclave. Hoping you're all well as usual. Is there anyone missing class today? She's missing class. Okay, we shall find out why she's missing class. Otherwise, in today's conclave, we are going to look at the non-pregnant uterus. We'll look at the non-pregnant uterus. And do you remember a scenario? We have a scenario. We are preparing a 20-year-old for pregnancy, labor, and puerperium, and we shall not prepare her. Remember, I gave you a scenario already, and I'm just like revising it with you. Let's prepare her, but let us first understand the anatomy, then later we shall tell her what to do if she's interested in conceiving, containing pregnancy. We look after her in labor and then puerperium. So today, right away, we shall do the description of the anatomy of the non-pregnant uterus. People, there's a difference between a non-pregnant uterus and the uterus that is not pregnant. A very big difference. The anatomy is changed. So for me right now, I'm going to look at the non-pregnant uterus. You shall look at the pregnant uterus in another showdown as we prepare it for you. Yes, I wish you a nice listening and a nice learning. So still, don't forget that we have to look at the definition, situation, shape, size, structure, growth, and the microscopic structure. And then we look at the blood supply and those blood supply, lymphatic drainage. I always remind you that, such that when you're describing the anatomy, you look at all that in the description. However, I need to tell you that in case they ask you for any question in the exams that we prepare you for, we'll always answer what is being asked. But today, for you to learn the anatomy, you must learn all of those, including relations, including blood supply, including functions, and everything. Yes, hoping we are together. So by definition, a uterus is a hollow muscular organ of the female reproductive system. The uterus is a hollow muscular organ of the reproductive system. It is situated in the true pelvis, but inside the true pelvis, it is always attaining a position which is anteverted and anteflexed. Now, anteverted means leaning. This is anteverted. And leaning forward, flexed means bending forward. So the uterus is in that position. And the body of the uterus lies above the urinary bladder. The shape, the uterus is ovoidal in shape, or you can say it is pear-shaped. This is a uterus. We said it is a hollow muscular organ. It is a hollow. Inside it, there is a hole. Do you imagine how a baby is conceived and grows inside the uterus? And you imagine, your cerebrum has a high mental power of imagination, so you can be able to imagine that the baby is delivered out, and then what goes about the uterus? It remains hollow. So it is a hollow muscular organ. You can see there is a hole inside. Yes, hollow muscular organ. I've said it is situated into the pelvis in an anteverted and anteflexed position. This always is anteverted and anteflexed. You can be able to look at my uterus, which is anteverted and anteflexed. It leans forward and bends. It leans and bends over its body. The shape. This is the shape of the ovicle. This is the shape of the ovicle. Those great guys that studied anatomy and gave us the information looked at this and they saw that it is an avocado shape. Or you could say it is a pear shape. Are you able to see? Yes? Do you see this? This is our uterus. Then you have is having, as long as you are a female. Males don't have a uterus. That you know? Okay. Size now, the size of the uterus. The uterus is 7.5 centimeters long. The uterus is 7.5 centimeters long in length. its length is 7.5 centimeters. Then when you look at the width here, it is 5 centimeters. The width is 5 centimeters. But now when you get to its thickness, the thickness is always 2.5. By thickness, this is what I mean. Its thickness like this. The thickness is 2.5 centimeters thick. The non-pregnant uterus has a weight. It always weighs 60 grams. Remember, the pregnant uterus has a lot of weight because it is containing the placenta, the amniotic fluid, the chorion amnion. It is containing also, it is going to weigh more, much more than the non-pregnant uterus. The non-pregnant is 60 grams. Let's look at its growth structure. You learn to draw the diagram of the uterus and draw the diagram of the uterus just like that. We are able to draw okay, then it has the cervix and the vagina. This is the cervix to it. Said the cervix is having also having os. This, I think you're able to know this. Okay, we are not looking. The cervix, remember, is part of the uterus, but now for us are not looking at cervix. Reason being that we finished its anatomy. Do you remember? We now want to look at the cervix, which makes up 2/3 of itself, that upper part. So the upper part here is known as the body or corpus. It is that whole part of the uterus. This is the corpus. The whole of this is the corpus or the body, the uterus. And it contains the following parts. We have this part is the fundus. And this one is the conua. This one is the inside. There's a hole known as a cavity. Remember, a cavity means a hole. Inside there's a hole, it is a cavity. Then it has what we call the body, and this is the body. And then it has the narrow part here, known as the isthmus. So that is the part of that is the uterus. This is how we draw it. So this is the fundus. It is the part that grows and increases in length. In case a woman is pregnant, it's one that goes on growing, increasing as the fetus goes inside. And even when you're doing abdominal examination and you want to find out the weeks of amenorrhea, you touch the fundus. You look at the fundal height and see where the height of fundus is. So this is the fundus. And now the uterine tubes enter at a point known as conua, and this is the conua for this uterus, conua here. Then we have the cavity. Inside, I told you, there is a cavity you can be able to feel. Then we have the body. This is the body of the uterus, as you can see. Then lastly, we have the isthmus, just down here, which is the narrowest part of itself, that is known as the isthmus. Now, dear learners, this is the anatomy of the gross structure of the uterus. Yes, right away, we can now go to the microscopic structure of the uterus. The microscopic structure of the uterus is that part of the uterus that we cannot see inside by the naked eyes, but you only need to use a microscope probably to see the features that I want to talk about. Okay. the microscopic structure of the uterus. It's made up of 3 layers. We have the endometrium, we have the myometrium, and then we have the perimetrium. Now, endometrium is the inner layer, the inside layer where the cavity is the inner layer. Then the muscle layer is that muscle you saw me touch. The muscle layer. Myo means muscle. Metrium is a uterus. And then peri means outer. So the perimetrium is this now. If we are to plot, this is the endometrium, this is the, here is a muscle here, which is the myometrium, and then we have the outermost layer here, that is known as perimetrium. Endometrium, the one people, I want to tell you that when I'm teaching, I always start from the inner layer to the outer layer. And the inner layer is the endometrium, and it's made up of layers. The first layer, I don't want to clean my uterus, but I can clean away these other parts which were gross. Okay, so the endometrium has its layers. Inside here, there are also layers. We have the functional layer, we have the basal layer, and we have the compact layer. Now, we have the compact layer, we have the functional layer, and the basal layer. The compact layer is that layer that is next to the uterine cavity. The functional layer is the layer that sheds during menstruation, and the basal layer is that layer that is going to remain such that another functional layer regenerates and repairs and grows into another layer that is going to menstruate in the next month. So these are the layers of the endometrium. The layers of the myometrium are also 3. Myometrium is having muscle fibers. I don't know whether you have seen muscle of the cow. When you look at the muscle of the cow, it has lines like that inside it. So those are muscle fibers. Also in our uterus, it has those lines known as muscle fibers. So the myometrium has longitudinal muscle fibers, longitudinal. It has circular muscle fibers, and it has oblique muscle fibers. So, what are the longitudinal muscle fibers that are found in the myometrium, for example? These ones are the muscle fibers that run from the fundus to the isthmus below. They run like that. And these muscle fibers are very important because these are the muscle fibers that contract when a woman is in labor. There are hands that contract and retract such that they can be able to push the baby outside to be delivered. Then we have oblique muscle fibers. If I've told you the longitudinal muscle fibers, their work is to contract during labor, contract and retract during labor. Then the oblique ones will always move left, right, then right, left. Those ones are like that. So the work of the muscle fibers that are oblique in type is to ligature the blood vessels in case a woman delivers, where the placenta was planted, and it it separates and descends and it is delivered out, they are bleeding blood vessels. So naturally, God made these muscle fibers that they have to ligature. When the uterus contracts, they ligature the blood vessels. They are in a crisscross manner, and they are known as living ligature. So you can see them crisscross. So when the uterus contracts, they close up the what? They close up the bleeding blood vessels, and the woman can stop bleeding. These are very important. That's why they run left, right, such that they can close up all the bleeding blood vessels, and the woman does not get postpartum hemorrhage. Okay, we have other muscle fibers known as circular, and circular muscle fibers are found in the cervix. Remember we said they are found in the cervix, and this is the cervix. But we have others found in the conua. They're found at the conua end here, and their work is to dilate. Here they help the dilatation of the cervix, such that the fetus can pass, in case we had a fetus in here, and it was implanted here, and it is time for labor, and it has to descend. It must come out from here through the cervix here, and then into the vagina, and then into what? It will come out. Those are the circular muscle fibers. Now, what are these ones doing here? They prevent contractions from getting extended to the uterine tubes. So they help some dilatation, such that the uterine tubes don't what? Rupture. But also when you see when the uterus contracts, you know, the contractions begin at the conua. So by the time they begin like this, there's supposed to be a dilatation somewhere, such that the muscle fibers can begin to what? To contract and retract. Those are the muscle fibers. Lastly, we have the perimetrium. Now, I need to tell you people that the perimetrium does not have other layers or muscle fibers. For it is just there to protect the uterus, and it's the outermost layer of the uterus. Hoping you understand. Any questions concerning the muscle fibers or the layers of the uterus? Are you still sober and steady? Let's continue with the anatomy of the uterus, such that you can understand the anatomy, and we are able to help a woman, a 20-year-old, and others. We are able to prepare them for labor, help them through labor, through pregnancy, and through puerperium. So let's now look at the relations of the uterus. Relations are neighboring parts. But remember, we have anatomical positions: anterior, posterior, superior, inferior, lateral. So we use anatomical positions to tell or to describe or explain where the uterus is. Now, superiorly, remember, superior is above. Superiorly of the, I told you the uterus is in the what? In the pelvis. So superiorly, we have the intestines and the abdominal muscles. Superiorly, waguru. Anteriorly, we have the bladder and the uterovesical pouch and the anterior vaginal wall. Posteriorly, we have the pouch of Douglas and the rectum. This is posteriorly. Then laterally on the sides, we have broad ligaments and ureters, fallopian tubes, ovaries, and round ligaments. Actually, laterally, we have ligaments that help the uterus to attain its position of anteverted and what about the inferior part of it? We have the vagina being inferior to the uterus. We have not said cervix, because remember, cervix is part of the uterus, so we shall not say inferiorly the cervix. No, cervix is part of the uterus, it is its neck, but we shall say the vagina is the one that is inferior to the what? To the uterus. The blood supply. The blood that the arteries that supply the ovaries are known as uterine arteries. People, the uterus has its own arteries, Why? Because remember, it has to shed during menstruation. But as well, when a woman conceives, it has to supply plenty of nutritious diet, and nutritious substances, and oxygen to the baby. So it has its own arteries that supply it, and they are known as uterine arteries. Yes, the corresponding vein is what is called uterine vein. The veins are the ones that take away the deoxygenated blood and all that is not needed. Then we have lymphatic drainage. They drain into the internal iliac and sacral glands. Actually, most of the reproductive organs drain into the internal iliac and sacral glands. The innervation, if you look at the innervation, the nerves that supply it are the sympathetic and parasympathetic nerves, and I told you they are branches of the leaf Frankenhauser plexus. Those are the nerves that supply. Now, for the uterus to be in its position, whether anteverted, anteflexed, whether it becomes erect, because when it is pregnant, it is erect. But I told you we are looking at the non-pregnant one, but I just want you to get the differences. The supports, we have the round ligaments. They maintain the uterus in its position of anteverted and inflexed. They are very important. They extend from the conua at each side, pass down, and then they are inserted into the labia minora. Then we have the broad ligaments, which are not true ligaments, but they are folds of peritoneum. They are extending laterally between the uterus and the sides of the pelvis. Then we have cardinal ligaments. Cardinal ligaments also support the uterus, and some people call them also the transverse. Now, what are the functions of the uterus? After us looking at its anatomy and explaining what it is, how it looks like, what it contains, what are the functions? People, remember I gave you work in the discussion groups, and you had to discuss this. But now me, I'm just polishing what you had to discuss. And when I looked at your work, functions of the uterus prepares a bed for the fertilized ovum. So when the ovum is fertilized, it must implant into the uterus. So its function is to prepare a bed for the fertilized ovum. Secondly, the uterus has to accommodate and nourish the fertilized ovum for the gestation period, because remember it has its arteries and veins. It accommodates and nourishes the fertilized ovum from the time it is a zygote to an embryo to a fetus until it is delivered out. And when fertilization begins and is delivered out, the uterus will stop accommodating it. But before it is in utero, it has to accommodate it. The third one is the uterus contracts and expels the products of conception. It has to contract, and expel products of conception. By products of conception, I mean the fetus and the placenta and all that is not necessary, which must come out after 9 months. Then the uterus remains now normal and evolutes. So the other function actually is it evolutes after childbirth or following childbirth. The uterus, I want to tell you and to remind you that it is a site for intrauterine device. That's where the device is inserted such that a person does not conceive when they are not ready to conceive. It is a contraception, it is a contraceptive device, so it prevents somebody from conceiving. When it is in tissue, for example, if it is a copper T, it emits iron that is spermicidal, so it's not going to allow the the implantation and the embedment, and even conception. The uterus sheds during menstruation. The uterus sheds during menstruation. That is its function, because we said it has the functional layer that is supposed to shed during menstruation. Then probably the uterus is diagnostic. It is a diagnostic organ. How diagnostic? It can help one to know whether somebody has fibroid, because they always implant inside there. And it is diagnostic because it can have cancer cells within, so they can diagnose cancer of the uterus. My dear learners, thank you for this listening, and I want you to ask questions. Thank you for listening to me. Now, those are the functions of the uterus. I want you to ask me questions. Ask me the questions. I have all the potential to answer any question that you have, my dear learners. I know I can answer. If I cannot answer, then can try out on Master Google. These are internal hour for the good listening and the good time you have given me to listen. I always say God bless you for me. Thank you.